Hello, everybody, and welcome back. DangTeach at CCSD. So we're finishing up our last few lectures, and at the end, I got a special announcement. Today's lesson is community pharmacy, another two-parter. So we'll do part one today and part two afterwards. All right, community pharmacy, aka retail pharmacy. So we're gonna be dispensing meds directly to the public. So if you like a lot of people interaction, that's gonna be the best place for you. So there's gonna be constant face-to-face. If you don't like dealing with the public, go the hospital route, and that'll be the last chapter I'll need to load up for phase one. 60,000 locations, so they're mostly CVS and Walgreens now. It used to be at every corner there was a gas station, and then for a while there were pharmacies on every corner. Let's talk about the different types. So independents, not too many left. CVS and Walgreens, of course, bottom out in the last 30 years or so. But you'll still have some in the San Diego area, like the Medicine Shop. That's kind of franchised. JV's Pharmacy, Ron's Pharmacy, things like that. Chain pharmacies, we mentioned, only two left in the game. And then the mass merchandisers like Walmart, Costco, Kmart used to have their pharmacy as well. And then lastly, food stores, like your grocery stores. Nowadays, I think in every Vons there's a CVS. One of those companies had a, no, sorry, Target. Inside every Target there's a CVS. Government regulations. So regulating community pharmacy. So OBRA 90 was a federal act, so it only affected federal patients initially. So a lot of harm could come from patients taking their drug incorrectly and end up costing taxpayers a lot of money. So that's why this is a budget act. So it required two things. Of course, counseling of the patients. That's how to take the meds, what the meds are for, what to watch out for, and how to get refills. And additionally, DURs, drug utilization review. So an automatic drug-drug interaction, drug disease, drug allergy interaction check. HIPAA, Health Insurance Portability and Accountability Act. So make sure you abbreviate it HIPAA, double A. So two parts, portability. So if you want to change jobs, you'll still have healthcare coverage through COBRA, and it established protected health information, which means you have to keep patient information confidential. So that came about because if you're changing jobs and I know your health history, I can potentially discriminate against you from getting that job. And another one covering retail pharmacy, 2003 Medicare Prescription Drug Improvement and Modernization Act, better known as Medicare Part D. So Part A, I'm just abbreviating it, simplifying it, is usually just inpatient. Part B will cover outpatient. Part C is supplemental, and D is for drugs. So initially, their seniors did not have drug coverage. They were covered when they went to the hospital or the doctor visits, but not if they got a prescription. So nowadays, at the ripe old age of retirement, they'll need to select a private prescription drug plan. So this is not a government offering, but they have to select a private plan and start buying into the system. And not all insurance company will cover all drugs, and not all drugs will be covered by any insurance company. So you got to know the list of drugs used by that patient and the list of drugs covered by the insurance, etc. Organization in the pharmacy, the transaction window. This is where you'll have a lot of patient interaction. And to be HIPAA compliant, the line usually starts about 10 feet back. That way the next customer does not overhear your conversation. The prescription counter, where you'll prep and maybe do a little bit of compounding. Try to keep it as clean as possible. There's usually a lot more material and items available. The computer system, so you'll be entering orders into the computer system. We'll practice that in COM 103 and subsequent classes. The refrigerator, drug storage only, so make sure there is no food, and that should be 2 to 8 degrees. So this is also known as cold storage. If they want cool storage, that's going to be room temperature, and that's going to be 15 to 30 degrees Celsius. So cold, refrigerator; cool, room temperature; frozen, in the freezer. So the drugs are organized alphabetically by generic name, and they're usually grouped together by route. So maybe here are all the eye meds, and maybe here are all the inhalers. For the retail pharmacy, not too much compounding, so you might have minimal scales, something to make suspensions or solutions, and maybe mix some creams or ointments. But other than that, that's about it in the retail. So very minimal compounding and equipment. Pickup shelves, so they're usually in hanger folders now because you don't want to be able to read HIPAA information. So they're in more opaque bags. Which of the following legislation, over 90, HIPAA, or Medicare Part D, required, I gave it away, Medicare Part D. So the Medicare Modernization and Improvement Act of 2003, better known as Medicare Part D. Which one required patient counseling to prevent drug error and harm and costing more money? Will that be a budget issue? So that's OBRA. Which one establish protected health information, PHI? That would be the accountability portion of HIPAA. Let me draw some lines here. So there you go. OBRA, HIPAA. Drug utilization review. So that's part of safe medical practice. Check drug-drug interactions and check drug allergy, drug disease interaction. OBRA 90. Continuance of healthcare coverage. That would be the portability portion in HIPAA. So you can have health coverage when you change jobs through COBRA. Private prescription drug plans, PDPs. So at retirement, seniors will need to buy into the program. So that's going to be Medicare Part D. Customer service. So the pharmacy is usually going to be the last place that the patient goes to, and they're already feeling miserable. They've been waiting for their appointment. They waited in the office, and they drove all the way over to the pharmacy or walked down the stairs to the pharmacy. And when they drop off their prescription, you tell them, you gotta wait some more. So if you greet them with a smile and be very empathetic, usually you'll have a better experience. So in the retail, like CVS or Walgreens, be familiar with the store layout. They have items change all the time, especially during the seasonal times in that seasonal aisle. When you pick up the phone, just identify yourself as a technician. It'll save you a lot of time. A lot of times nurses and doctors will start spewing information intended for the pharmacist, and you would hate for them to have to repeat themselves. So if you acknowledge yourself as pharmacy technician, they'll know to get transferred to a pharmacist right away. Prescription processing. So first thing you probably ask, have you been here before? So if they say yes, all you gotta do is ask for any changes. But if they say no and they are new, then just collect all of their information, and you want to verify everything probably before you start entering the prescription. So for newer patients, let them know it might take up to about an hour. For refills, that might be a lot sooner, maybe 15 minutes if you're not busy, and then if it's a returning patient, 30 minutes. So that's if everything's running nice and smooth in your fully staffed pharmacy. Entering the patient information, so including the doctor's DEA number. So if you go to the regulation chapter, I showed you there how to verify DEA numbers. Check the directions. Cigna is directions. Quantity is usually followed by a pound sign. Sometimes they'll use Roman numerals. So in this case, XXX is 30. Refills, so make sure you know them for your schedules 2 through 5. And for billing purposes, make sure you have the most up-to-date. So we are in January, February. So every year, that's when the new group number would kick in. Refills. So based on the schedules, so for requests and refill authorization, a technician can actually take that. So for refills, it's just an additional fill. Nothing really changes. However, if it's a new script, make sure the pharmacist takes the new prescription. So for refills, either get it by number or by the patient's name and then, of course, history. And you can bring it up. So EDS is very important. Estimated days supply. That would trigger if it's too soon or too late, and then your script will be rejected. So if it's too soon, they're taking their drugs way too much. If it's too late, maybe they're not taking enough of their drug. C2s, of course, no refills. C3, 4s, and 5s, you have 5 refills within 6 months. And then for RX only, depending on the insurance company, usually it's PRN refills within a 12-month period. For interaction warnings, make sure that the override is done by the pharmacist. So it's real easy. All you got to do is click continue or enter. Make sure you call the pharmacist over so they can interpret this data. Define the following. What is OBRA? Budget. Omnibus Budget Reconciliation Act. And you want to specify the year. In this case, it's 1990. PHI, established through HIPAA, that is protected health information. Who are the DEA? Drug Enforcement Administration. DAW. So those are the dispense as written codes. OTC is over the counter, no prescription required. BTC, behind the counter, no prescription required. And HIPAA is Health Insurance Portability and Accountability Act, HIPAA. A few more questions. What is controlled refrigerator temperature, aka cold? So cold is 2 to 8 degrees. A C3 prescription can have how many refills? So C3 through 5, you can have 5 refills within 6 months. So you get your initial plus 5 more, so 1 every month for 6 months. Can a technician take a refill authorization over the phone? Yes. Just document who gave the authorization. But technicians can't take new scripts. Make sure that is for the pharmacist. All right, very good, everybody. We completed part 1 of retail pharmacy. So for next time, we'll conclude our discussion on community pharmacy. So not too many lectures left to post, about 3 left. And then after that, I got a special announcement for you guys. So thank you for hanging out with me, and I'll see you again. Bye-bye.